Welcome. Tech professionals and healthcare solution vendors will be particularly interested in this presentation. We are the NCCoE, and we provide an opportunity for technical teams and solutions vendors to work alongside each other to solve difficult healthcare, security, and privacy problems. Our freely available guidance has been downloaded over 600,000 times over the past 6 years. Please join me for a few minutes while we explore how NCCoE can help you. So who are we? NCCoE is a place where industry, academia, government all come together to solve difficult challenges. Who am I? I'm Sally Edwards, cybersecurity engineer with the MITRE Corporation, a nonprofit that operates federally funded research and development centers for the federal government. In this case, NIST, the National Institute of Standards and Technology's National Cybersecurity Center of Excellence, or NCCoE for short. At NCCoE, we bring experts together to address real-world needs of securing complex IT systems and protecting the nation's critical infrastructure. NCCoE helps businesses, large and small, manage cybersecurity risks by showing them how to use and integrate commercial off-the-shelf technologies to improve their ability to prevent, detect, and respond to cyber threats and vulnerabilities. Our facility is located in Rockville, Maryland, where we have 20 physical labs and more than 35 projects going. Most importantly, NCCoE is here because of you. Of course, our focus today is on healthcare and the work that NCCoE is doing to help secure healthcare. There are many new technologies in healthcare and new ways to use existing technologies. Providers and consumers are equipped with capabilities that were not possible before. And as a consumer, having tools to better manage your health is really exciting. But as the person or organization responsible for securing these technologies, it's terrifying. And the need to protect new technologies doesn't change the fact that healthcare data, PHI, remains highly prized among malicious actors. So this slide shows a simplified healthcare landscape and where NCCoE healthcare projects fit within that landscape. Our first 3 projects were hospital-focused: electronic health records, wireless infusion pumps, and PACS. We released the very first practice guide, Electronic Healthcare Records, in 2015. That was the first practice guide released, the first work released by NCCoE at all, not just in the healthcare sector. Our team has learned a lot since then. How? By engaging with you, our communities of interest. So what's a community of interest? The healthcare community of interest is composed of technology providers, healthcare delivery organizations, integrators, medical device manufacturers, associations, academics, government, and even individuals. It's through the community of interest that we learn the challenges facing an industry, in this case, healthcare delivery organizations. Our process is to learn of a security challenge that may be a good project where NCCoE can make a difference. Research and publish a draft project description for public comment. This allows the community to let us know if we have a good grasp of the problem. Do we really understand the real world needs? Or if we need to maybe revise our approach a bit. Once we have that feedback, we can move forward. Public participation is vital. Backing up for a minute, why is NIST doing this work? NIST develops standards and guidance. Technically, FIPS are standards, and any other cyber work from NIST is guidance. However, many outside of NIST will refer to these interchangeably, and so you may hear what is actually guidance referred to as a standard. So first, let's talk about what's behind NCCoE's work. The risk management framework. If you've done any cybersecurity work with the federal government, you're no doubt familiar with the cybersecurity framework. The cybersecurity framework has 7 steps: prepare the organization, categorize the system, select controls, implement controls, assess controls, authorize the system, and continuously monitor. The RMF integrates security, privacy, and cybersecurity supply chain risk management activities into the system development lifecycle. While the RMS is useful for and used by many industries, and I certainly encourage you to use it, it was initially created for the federal government, and it is quite complex. The cybersecurity framework, initially released in 2014 and revised in 2018, was designed to assist critical infrastructure and industry in the US. It's composed of 5 functions: identify, protect, detect, respond, and recover, and further delineated into 23 categories and 108 subcategories. Some categories can be considered as outcome-driven statements. So something along, for example, one subcategory is software platforms and applications within the organization are inventoried. The newest framework from NIST is the NIST Privacy Framework. It's a tool to help organizations manage risk and provide a common language for organizations to use when considering privacy. The privacy framework is closely linked with the cybersecurity framework. Now, there's not enough time today to discuss these in any depth. Each of these has been the subject of multi-day workshops. But for our purposes here, know that these frameworks and the associated guidance and controls are behind the works that we're discussing and all of the work that NCCoE performs. So moving back to our healthcare projects, this is a timeline of the work that we've done. As I mentioned, electronic health records, 1800-1 was the very first work that was released by NCCoE. The next healthcare project was securing wireless infusion pumps, followed by PACS, securing picture archiving and communication systems. That was released in 2019 and the final released last year in 2020. And finally, our current project, securing telehealth remote patient monitoring. So here's an image that shows a brief view of our architecture on each of these projects. So what were we learning as we were moving forward through these? So the very first project, 1800-1, that's where we really learned that the mapping was important. And so while the cybersecurity framework is the key piece through every piece of work that is published by NCCoE is mapped to the cybersecurity framework. 1800-1, we also mapped to HIPAA as we were just learning the healthcare community at that point. 1800-8, we expanded to include the NIST 853 security controls, IEC 80001, and ISO 27001 mappings. In 1800-24, the focus was really microsegmentation, and we began considering a bit of a ZTA concept as well as cloud storage. And 1800-30, we used a distributed architecture, 3 domains, and we also leveraged the NIST privacy framework. So as I mentioned, NIST 1800-30 is our current work. We actually selected this pre-COVID and with no concept of how relevant it would become. The key points are that it emphasizes risk assessment approaches, a distributed solutions architecture across 3 domains, and it extends the health IT ecosystem to patients' homes. While I won't say too much about this one, as it is the subject of an education session, Nikia Grayson and Sue Wang will be presenting on secure telehealth remote patient monitoring on August 11th. 1800-24, securing PACS. This solution covers 39 out of 108 subcategories of the cybersecurity framework. And this allows me to mention that we don't try to boil the ocean. We do not cover all 108 subcategories in each of our publication. Rather, we scope our projects on a particular challenge. And while that does not provide an end-to-end security enterprise solution, it does provide a very focused solution that clearly identifies what we're addressing and what we're not in a particular publication. This target architecture demonstrates control measures such as microsegmentation and network segmentation, network zones using VLANs, cloud storage for long-term archiving, secures data communications, and serves to enhance resiliency and recoverability for HDOs that may be subject to an adverse event. 1800-8, securing wireless infusion pumps. Wireless infusion pumps were a major news event several years ago. We were fortunate that with this project that we had many pump manufacturers participate, and indeed the manufacturers covered about 85% of the US market. So in exploring our solution, some of the key concepts and controls displayed in this guide were zoning, network controls, limiting implicit trust between network zones. As we were doing our research for this project, we learned that at that time, many of the providers still had flat networks. So network zoning was really an essential piece of securing that. Network and remote access controls, and implementing network controls to mitigate medical device endpoints limitations. And finally, as I mentioned previously, NCCoE's first practice guide was 1800-1. The key concepts here were authentication, auditing and monitoring, and mobile device management. This allows me to share that while our focus here is healthcare, NCCoE produces many works. Some, like the works here, are sector-based. We also work in energy, manufacturing, finance, retail, and other critical infrastructure areas, but we also do technology-based projects. Relevant here is one of our more recent mobile projects, or one of our more recent projects was a mobile device security project, 1800-21 mobile device security, corporate-owned personally enabled devices, and 1800-22 mobile device security, BYOD. These are just two examples of work that, while they're not specifically oriented towards the healthcare community, they could be very relevant to your organization. I would invite you to take a look at nccoe.nist.gov and see the breadth of the work that we're publishing. So what's next? August 11th, as I mentioned, Sue Wang and Nakia Grayson will be presenting here at HIMSS on the telehealth cybersecurity remote patient monitoring ecosystem. Outside of this, at the end of August, NCCoE has a learning series. It's a regular series, but this particular event will be Project Spotlight, Telehealth Remote Patient Monitoring. Once again, please go to nccoe.nist.gov to register for this event. And finally, the NCCoE healthcare team plans to release a new smart home integration project description sometime this fall. So stay tuned for that. We'd love to hear your feedback. If you'd like to get in touch with us, my contact information is there. More importantly, the healthcare team, their email address is hit_nccoe@nist.gov. And I just want to highlight this photo here. This is a picture of our lab. And normal times we have tours going through our labs periodically. And this is a picture from one of those. So obviously we're not giving tours now. Certainly hope to give tours again soon, and that you are able to visit with us at some point in the future. Finally, I just wanted to provide a link to the resources that I've mentioned. Obviously, nccoe.nist.gov, as well as the frameworks, the cybersecurity framework, the privacy framework, and the risk management framework. Thank you so much for joining me today.